Med student tries to lighten the mood by making a joke. Oscar actor.
You know how I hate comedy.
Hi guys, welcome back to the channel. My name is Kiran, I'm a junior doctor and a comedian. And in today's video, I'm gonna hit you with medical memes part 2 video edition. If you're new here, make sure to subscribe. Otherwise, let's get into it. I'm gonna put the memes around here, so that's why I'm slightly off center. That med student who answers all of the questions during the ward round.
Maybe someone's don't like me, but because maybe I'm too good. I don't know why.
Cristiano. There's nothing wrong with being a keen medical student and wanting to learn, but sometimes there's these gunner medical student who try and put other people down as well, and that's the kind of person who you try and avoid. Doctor, come find me later and I'll sign you off. Med student.
Just send me location. Send me location. Just tell me where.
Just send me location.
If you send me the location, then I'll be right there.
As medical students, you have this little book that you need to get signed off by lots of different people, and there's lots of skills that you need to get seen by a doctor to do, and then they can sign you off to say you're competent at doing that. So things like taking bloods, putting in a catheter which goes inside the bladder, putting in cannulas, taking arterial blood gases from the wrist, and there's some doctors who are slightly more lenient at giving their signatures away than others.
It's our ball, ain't it? It's our ball! Hey! It's our ball! It's our ball!
If a teenager comes into A&E with testicular pain, one of the things you'd be worried about is testicular torsion. This is where the testicle can twist, and actually if that damages the blood supply, you could actually lose that testicle, so it's actually an emergency. They'll do an operation where they open up the scrotum and they'll have a look and see if it is twisted or not, and see if it is their ball.
It's our ball! Hey! It's our ball!
When the consultant tells a bad joke, but they're doing your sign-off. When we're at medical school, we have these books that we have to get signed. These have all our competencies of loads of different things, including patients that we've examined, blood tests that we've taken, things like that that we have to get signed off during our time in a placement. At the end of that, you have an overall sign-off with a consultant. That consultant basically says, yes, they've been here and they've done what we've expected them to do. You're eagerly, obviously trying to please this consultant to make sure that there's no issues with your sign-off, and you'd laugh like this at their jokes. That's like really creepy. I'm not going to do that again. Inspecting a patient from the edge of the bed during OSCEs like... OSCEs are the clinical examinations that we have as medical students, and when you're examining a patient, one of the first things that you have to do is inspect. So you stand at the end of the bed, you have a look, and you see what kind of clues you can pick up as to what might be wrong with that patient. So you might pick up if they've got inhalers nearby. You might notice some nicotine staining on their hands that mean they might be a smoker. You might see a distended abdomen that show they might have liver disease. There's lots of things you can pick up just by looking from the bedside. This part of the exam, it's like a Sherlock Holmes type thing, and it's pretty much exactly like you've seen in this video.
That was a jolly good answer.
Sorry.
That was a vintage answer. That was a
Trying
jolly
to
good
defend
answer.
myself after listing idiopathic
That was a vintage
as a
answer.
cause of disease. Idiopathic just means that we don't know what causes it, but it's a fancy medical term for it. For example, idiopathic pulmonary fibrosis. So pulmonary fibrosis is scarring of the lung, and idiopathic means we don't know what's caused that scarring.
Tonight, we don't play yes man. For tonight, you are titans. For what can stand between lions and titans? You will be legends. The choice is not yours. For history has already seized your hands. You are the chosen ones.
This is like the most motivating thing I've ever seen in my life. First year clinical students hyping each other up to take blood from their first patient. It can be really daunting taking blood for the first time, especially when you're a new medical student. And it's good to go in groups and to hype each other up, I remember this. When you insert a cannula into a dehydrated 80-year-old patient and see flashback, and then we've got Tiger Woods there doing this one. A cannula is an intravenous line that we put into a patient to give them antibiotics and fluids usually. And flashback is what happens when you actually get that cannula into the vein. They can be really difficult, especially with elderly patients, so get in there. Med students. Med students leaving the ward after doing absolutely nothing all day. But my favourite bit is when he goes, can you imagine a med student doing that on the ward?
Son of a bitch, Paul, why didn't you just go home? That's your home! Are you too good for your home? Answer me!
A&E consultants trying to discharge patients like. A&E I think is really tricky because they have a decision about whether they're going to admit patients or whether they're going to send them home. And that can be a really tricky thing to do because there physically isn't enough space for everyone who comes in to come into the hospital. So you have to decide what's clinically urgent and who actually needs to be there. Consultant, why are you leaving the ward so early? Me after getting signed off.
Ain't nothing I want more. I told you when I first came here, I said I ain't come here to waste my time.
So I mentioned before that medical students have these little books that they need to get signed off with lots of skills in. Occasionally you'll have an attendance log in this book. And after you've had the attendance log signed, a lot of people will just go home. I mean, never me. I was always on the ward all of the time, learning. Med students at Grand Rounds be like, and all these monkeys are smashing this free food. So Grand Round is this big teaching thing that happens, usually weekly, and there's often free food because it's sponsored by someone. I mean, I'm not saying I go just for the food, but it's definitely a huge part of why I want to go to Grand Rounds. Just like these guys. Nurse, why are you crying? Med student after sighting a cannula on an elderly patient.
It's been a long fight. It's been a long fight, and I just had to have a warrior spirit, and that's all.
It can be really difficult to put cannulas in elderly people, especially when they're dehydrated as well. So when you get it, you know, like Drake, it does feel like it's been a long fight. It's just that I would try. It's just been a long fight. Happy with a good guy, but I've been trying so much.
On the scale of 1 to 10, how much are you shitting yourself?
47.
Bowel prep is normally what we give to patients before they have a colonoscopy. So that clears out the bowel. So we give them lots of laxatives and maybe we'll give them an enema as well, which means that their bowel is nice and clear. So when we put the scope in, you can see a lot better.
Sometimes it may be good, sometimes it may be shit.
Summarise medical school. Sometimes it's good, sometimes it's
shit.
Less good, especially around exam time. Smokers when you tell them they've been diagnosed with COPD.
How I'm saying,
so
how, like...
COPD is chronic obstructive pulmonary disease. It's normally caused by smoking for long times, although you can get it if you've not smoked. This one's about how patients always act so surprised that they've got lung disease when they tell you they've smoked 50 cigarettes a day for the last 50 years.
How? Hold on, bro. How I'm saying, how, like...
When the consultant asks if you would like extra teaching at the end of the ward round.
Time to go!
They'll usually ask this to a group of students as a whole, and there's always that one guy who starts asking loads and loads and loads of questions. Like, why? Med student tries to lighten the mood by making a joke. Oscar actor.
You know how I hate comedy.
This is from Indian Matchmaking from Netflix as well, which is a show so close to my heart. OSCEs, as I mentioned before, are these exams that we have where you pretend to take a history or examination from a pretend patient and then there's an examiner who's watching you. And I often try to do that, try and make things a little bit lighthearted, try and lighten things up a bit, but they've often got a brief. For example, cry at 4 minutes, and there's absolutely nothing you can do because they hate comedy.
You know how I hate comedy.
I've mastered the ability of standing so incredibly still that I've become invisible to the eye.
It's so difficult when you're a medical student because you really feel like you're in the way so often. You do feel like you're invisible because other people are so busy doing their own things that people forget about you. That's why I always say to doctors, never forget the medical students, because that was us once. I remember standing there and people ignoring me, and it's just the worst feeling ever. Try and engage with them, try and send them off to do something like take a history or examine a patient and then get them to come back and present it to you. Consultant. So who has a case to present? Med students. Silence. I remember this. Please interpret this ECG.
I can't read it. There's no words on it. There's no words there.
So an ECG is an electrocardiogram, which is heart tracing, which obviously has no words on it. And this news anchor's really having difficulty interpreting it.
I can't read it. There's no.
It's the biggest piece of dog shit that I have ever heard. Everyone's laughing, by the way, but it's true because everybody's heard it too. Everyone heard it, right? They look at all. Everyone's like, "Yeah, big piece of dog
When
shit."
you tell your consultant your differential diagnosis. So basically, when you've taken a history and examined a patient, you're meant to come up with a differential diagnosis. It's no good just taking the information. You need to be able to interpret it and say, "I think this is gallstones. I think this is a heart attack. I think this is pneumonia." And as a student, because you don't know everything about all of these conditions, it's really difficult to come up with a list of differential diagnoses. And this is The Rock who's saying that his are
dog shit.
I hope you enjoyed Medical Memes video edition. If you did, drop a comment below and I'll look at doing some more. Make sure you're subscribed to the channel so you can get updates about future videos. Take care, guys, and I'll see you soon.